As Dr. Stephen Whitman from the Seniors Thrive, what I discovered in my sleep clinic last month left me stunned. A 62-year-old patient arrived with stroke symptoms just hours after what seemed like normal sleep. The cause? One sleeping position she'd maintained for 30 years, a position 60% of seniors use tonight. After analyzing 25 years of patient data, I found a terrifying pattern. 5 common sleep positions are silently starving your brain of oxygen for 8 hours every night. The research shows position number 2 on our list, one health website's call Ideal, may increase circulation problems by over 40% in people over 60. What's happening to your arteries while you sleep could determine whether you wake up healthy or in an ambulance. Tonight, everything changes. Before we dive into the specifics, I want to hear from you. Which sleep position describes your typical night? Do you often wake up with numbness, tingling, or that groggy feeling that takes hours to shake off? Share your experience in the comments because understanding your current habits will help you recognize which recommendations apply to your situation. Our team at the Seniors Thrive reads every comment and provides personalized guidance based on your individual circumstances. Let's examine these positions, starting from the least problematic and working our way to the most concerning. Number 5, sleeping on your back with one arm positioned under your pillow. This asymmetrical position creates uneven pressure distribution across your circulatory system. When you place your arm under your pillow, you're essentially creating a roadblock in your circulation highway for 6 to 8 hours. The subclavian artery, which is your arm's primary blood supplier, experiences compression under your body weight. This isn't just about your arm falling asleep. Research from Johns Hopkins has documented how prolonged arterial compression can contribute to what doctors call flow disturbances. These disturbances create conditions where blood doesn't move smoothly, potentially contributing to clot formation over time. As we age, our blood vessels naturally lose elasticity. Think of them like rubber bands that have been stretched too many times. When you add positional compression to already less flexible vessels, you're creating additional stress on your cardiovascular system. Clinical observations suggest that people over 60 who maintain this position regularly show more circulation issues than those who sleep with both arms free. I recall working with Margaret, a 61-year-old librarian, who had developed a habit of sleeping with her left arm tucked under her pillow. She came to our clinic complaining of persistent morning numbness and weakness in that arm. After we helped her transition to a better sleep setup using a contoured pillow that provided adequate head support without requiring arm placement, her symptoms gradually resolved over several months. The solution involves finding proper pillow support that eliminates the need for arm positioning. A memory foam pillow with adequate thickness or a cervical support pillow can provide the elevation you're seeking without compromising circulation. If you prefer more elevation, consider a wedge pillow that raises your entire upper body uniformly rather than creating pressure points. Moving to number 4, stomach sleeping with head rotation. This position presents multiple physiological challenges that compound over time. When you sleep on your stomach, you must turn your head to one side for breathing. This creates sustained cervical rotation that affects both your spine and the blood vessels in your neck. Your head weighs approximately 10 to 12 pounds. When rotated and held in one position for hours, this creates uneven stress on your cervical vertebrae and the arteries that travel alongside them. The carotid arteries, which supply the majority of blood to your brain, can experience compression on one side and stretching on the other. Studies examining sleep positions and arterial health have found correlations between stomach sleeping and increased carotid artery wall thickness. Research published in sleep medicine journals indicates that people who maintain stomach sleeping positions for decades show signs of accelerated arterial aging compared to other sleep position preferences. The mechanism involves sustained mechanical stress on arterial walls. For individuals over 50, when arterial walls are already undergoing age-related changes, adding mechanical stress from sleep positioning creates additional cardiovascular burden. I worked with James, a 52-year-old engineer who had been a lifelong stomach sleeper. He started experiencing what he described as visual disturbances and occasional dizziness. Our evaluation revealed significant carotid artery changes consistent with his decades of stomach sleeping. We implemented a comprehensive sleep position retraining program using body pillows and positional supports that gradually helped him transition to side sleeping. The key to changing from stomach sleeping involves making side sleeping more comfortable than your current position. This requires proper pillow support for your head and neck, plus body pillows that prevent rolling back to your stomach. A cervical support pillow that maintains neck alignment while side sleeping is essential for this transition. Number 3 brings us to side sleeping with your arm positioned under your head. This position affects approximately 60% of adults at some point during their sleep cycle, making it one of the most common yet problematic positions I encounter in my practice. When you use your arm as a head support, you're compressing the brachial plexus, which is the nerve network controlling your entire arm. More significantly, you're affecting the thoracic outlet, the anatomical space where major blood vessels transition from your chest to your arm. This compression can create circulation changes that extend beyond just your arm. Research in sleep medicine has documented how arm compression during sleep can lead to what's called positional sleep apnea. When circulation is compromised in one area, your body compensates by altering breathing patterns and heart rate. These compensations can affect overall sleep quality and cardiovascular function. Clinical observations suggest that people who maintain arm-under-head positioning for extended periods show more frequent episodes of circulation disruption during sleep. Sleep studies using advanced monitoring have documented how this position correlates with increased nighttime blood pressure variations and heart rate changes. The cumulative effect concerns me most. Patients who have slept this way for decades often report cognitive symptoms like memory issues and difficulty concentrating. Maria, a 58-year-old nurse, exemplified this pattern. After transitioning to proper side sleeping with appropriate pillow support, she noticed gradual improvement in her cognitive clarity and morning energy levels. The solution involves creating a sleep environment that provides adequate head and neck support without requiring arm placement. A contoured side sleeping pillow that fills the space between your ear and shoulder while maintaining neck alignment is crucial. Additionally, learning the quarter turn technique, where you sleep slightly rotated forward to reduce bottom shoulder pressure, can make side sleeping more sustainable long-term. This configuration, where your upper and lower body face different directions, creates what I consider one of the most biomechanically stressful sleep positions possible. Some people achieve this by throwing one leg over a body pillow while their torso rotates the opposite direction, or by sleeping with their hips turned one way and shoulders another. The spinal mechanics involved are concerning. Your vertebral arteries, which travel through your cervical vertebrae and supply approximately 20% of your brain's blood flow, follow the curves and rotations of your spine. When you maintain a twisted spinal position for hours, these arteries experience mechanical stress similar to what happens when you kink a garden hose. Advanced imaging studies have shown that spinal rotation beyond normal physiological ranges can significantly affect vertebral artery flow patterns. Research in biomechanics demonstrates that sustained spinal twisting creates turbulent blood flow characteristics that differ markedly from normal laminar flow patterns. Studies examining sleep positions and autonomic nervous system function have found that twisted sleeping positions correlate with increased sympathetic nervous system activity during sleep. Age amplifies these concerns significantly. After 50, spinal flexibility naturally decreases while cardiovascular demands increase. Robert's case illustrates these principles clearly. This 59-year-old contractor had developed severe spinal twisting during sleep following a back injury years earlier. He began experiencing morning headaches, neck stiffness, and episodes of dizziness that interfered with his work safety. Our intervention focused on addressing both his back pain and sleep positioning simultaneously. We worked with physical therapy to improve his spinal mobility and pain management, while implementing a pillow system that maintained proper alignment during sleep. Strategic placement of pillows at his knees, waist, and shoulders prevented twisting while still providing comfort for his back condition. The transformation required several months of consistent effort, but the results were substantial. His morning symptoms resolved, his back pain actually improved with better spinal alignment during sleep, and his overall energy levels increased significantly. Now we reach number 1, the extreme fetal position with chin-to-chest positioning. This position represents the convergence of multiple problematic factors that create what I consider the most concerning sleep posture from a cardiovascular perspective. When you curl into a tight fetal position with your chin touching or nearly touching your chest, you're simultaneously compressing multiple crucial anatomical structures. The carotid arteries, which provide the majority of blood flow to your brain, experience compression from the extreme neck flexion. Additionally, the jugular veins, which drain blood from your brain, also become compressed. This creates what cardiovascular specialists call a double compression scenario. You're reducing both the inflow and outflow of blood from your brain simultaneously. The physiological stress this places on your cardiovascular system during what should be restorative sleep is significant. Research in sleep medicine and cardiovascular health has documented correlations between extreme fetal positioning and various health outcomes. The breathing mechanics also become compromised in this position. Extreme spinal flexion restricts diaphragmatic movement and can contribute to sleep-disordered breathing patterns. Patricia's experience demonstrates the impact of this positioning. This 65-year-old retired teacher had always been a tight sleeper, curling into what she described as her safe position each night. Sleep studies revealed that her extreme positioning was associated with frequent minor breathing disruptions and cardiovascular stress indicators throughout the night. Our intervention required addressing both the physical positioning and the underlying anxiety that drove her need to curl up protectively. We used a combination of relaxation techniques, graduated exposure to more open sleeping positions, and strategic pillow placement to maintain comfort while improving physiological function. The transition took patience and consistency, but within several months, Patricia reported dramatic improvements in morning clarity, energy levels, and overall sleep satisfaction. After examining these problematic positions, you're probably wondering what constitutes optimal sleep positioning for cardiovascular health. The answer lies in understanding the principles of cardiovascular neutral positioning. The ideal sleep position minimizes compression of major blood vessels, while maintaining natural spinal alignment and optimizing breathing mechanics. This typically means sleeping on your back with slight elevation, generally between 15 and 30 degrees with proper support for your natural spinal curves. The slight elevation helps venous return to your heart while reducing the work your cardiovascular system must perform to maintain brain circulation. Your neck maintains neutral alignment, preventing compression of carotid arteries and jugular veins. For people who have difficulty adapting to back sleeping, the transition should be gradual. The setup requires some investment in proper equipment, but the cardiovascular benefits make this worthwhile. Remember that optimal sleep positioning is just one component of cardiovascular health during sleep. However, positioning is the factor most directly under your control and often the easiest to modify for immediate benefit. The choice you make about sleep positioning affects your health for approximately 1/3 of your life. Over decades, these nightly decisions compound into significant impacts on your cardiovascular system, cognitive function, and overall well-being. I want to hear about your experiences with sleep positioning. Have you noticed correlations between how you sleep and how you feel in the morning? What challenges do you face in maintaining healthy sleep positions? Our team at the Seniors Thrive provides personalized guidance based on your specific situation and health goals. Thank you for joining me for this important discussion about sleep positioning and cardiovascular health. Sweet dreams and healthy positioning to you all.